Ready.
Bismillahirrahmanirrahim. The topic of my presentation is designing the recipient area achieving cosmetic density in hair transplant. First of all, I am very thankful to my seniors, especially Dr. Waris Anwar, who has given me this chance to interact with you. And I am extremely sorry that I could not join you physically. I'm Dr. Waqar Maqsood. I'm licensed dermatologist with Pakistan Medical and Dental Council. I recently qualified with American Board of Hair Restoration Surgery, and I'm very thankful to my seniors who always guide me regarding the hair transplant procedures. The agenda of my presentation is that first of all, bordering the canvas and understanding the canvas is very important. That when we are designing the recipient area, we need to understand that this canvas is alive and what are the features of this canvas. The second thing that I will focus on about the cosmetic density is about the visual impression of the density. One is the natural density and one is the cosmetic density. So we will see about multiple factors that can be effective for creating the cosmetic density. The third thing is the Kure-Erdogan coverage value concept. I am very much impressed by his coverage value concept. I will try to explain quickly about the coverage value concept, and you can calculate easily when if you will listen to me carefully, you will be easily identifying that how many graft per centimeter square you need to put to get the cosmetic density in the concept of coverage value. The fourth thing is that I learned from Dr. Humayun Mohammed by his talks in the WhatsApp group about the judicious maneuvering in achieving cosmetic density by determining the hairstyle before. And the fifth thing I would like to talk about is a little bit about graft interlocking. That is an academically neglected but important concept. So when we talk about that this canvas is alive, we are artists. Hair transplant surgeon is an artist and his canvas is alive. The first thing is vascular vitality index. The scalp's vascular vitality index is more than 95%. That means the scalp is fully painted with life and it is a canvas soaked in color. That color is red. So this we need to keep in mind. The second thing is when we understand the canvas, the follicular receptivity quotient is very important. That means that our canvas has more than 8.5 out of 10 the follicular receptive quotient. The scalp's ability to accept and support the transplanted follicles. The third thing that is very important to understand the canvas is dermal elasticity ratio. Dermal elasticity ratio is more than 70% in the scalp. That means the flexibility and youthfulness of the scalp is that our canvas is that bends but does not break. And this canvas that bends but does not break is very important for making the surgical sites over this scalp. The fourth thing is cellular regeneration score. Cellular regeneration score means that skin cell turnover and healing power. This is a self-renewing canvas that heals after every brush stroke. And the fifth most important thing is thermal conductivity harmony. The scalp temperature is usually 33 to 35 degrees centigrade and the scalp stable temperature supporting cell activity. That means a painter's palette is in motion always. So these things need to understand that our canvas is alive. So first of all, when we're making the surgical site, we need to border. Like if anyone is interested in painting, we first need to border the canvas. Same is like chapter 24, our Bible, this Rabanangar 6th edition, Dr. Michael Behner wrote in the key points, virtually all men with balding can be transplanted if a four-log pattern is used. Like if you see in these pictures that the four-log patterns and the hemi-oval four-log patterns and the parietal humps, this means that if we border the canvas in a proper shape, then we can get the cosmetic and natural looking hair transplant. So if we see in the first picture, there is the shield four-log pattern, and the shield is a very famous picture. Everyone has seen it before. This shield four-log pattern means that there are two triangles at the sides and one triangle at the back, and the parietal humps. Parietal hump is the most important part, and I myself consider it as the part of the frontal hairline, that if you do not consider the parietal humps as important, then it means that you are lacking in something very important. Recently, Dr. Anil Garg has written a complete paper over the parietal humps. So the bordering the canvas, as in these pictures, and these three most important designs, the frontal forelock, the shield forelock, the parietal humps. So bordering the canvas is most important for the creating the natural and cosmetic position for the grafts. Now, what does mean the poor density? The poor density means that appearance of sparse or thin hair coverage in the treated area. So we see every day so many cases in which there is the hair transplant done, the graft survival is okay, but usually in my case, this is my own case, and this 10 to 15 grafts per centimeter square I put because the number of the grafts were less, and I was thinking that 10 to 15 grafts will be good. But if you see in this picture, you can see that the grafts have survived, but the visual result is disappointing. This is another case. This you see, in this case around 45 grafts per centimeter square has done. The cosmetic density is achieved, and the cosmetic density is the perceived fullness of the hair. It is not exactly the same amount of the hair graft, but it is the perceived fullness of the hair. What does mean perceived fullness? That it is mathematically influenced by the number of the visible hair shafts per square centimeter. Typically more than 30 to 40 grafts per centimeter square if the hair caliber is 0.03 to 0.06 mm between this, then 30 to 40 grafts per centimeter square is sufficient and visually enhanced by the factors like hair thickness, color contrast and styling that creates the illusion of the greater coverage. Now we come to the most important and the pillar of my presentation, this slide, that is Curry-Erdogan's coverage value concept. The minimum coverage value of 5.4 has been determined by Curry-Erdogan and his predecessors. Like, we are impressed by Curry-Erdogan, Dr. Mughis Amin, Dr. Humayun Mohammed, Dr. Anil Riaz, Dr. Waris Anwar. Similarly, the people by whom Dr. Curry-Erdogan was impressed, he has quoted their writings and concluded that the coverage value should be 5.4. But how he concluded? If you see in this slide that he made a formula in which he put follicular unit per centimeter square multiplied by hairs per follicular unit multiplied by hair shaft diameter. So he concluded by minus 15% he did due to decrease in hair numbers or hair caliber with life. So that is equal to, if we do 45 grafts per centimeter square and we consider that there is 2.2 hairs per follicular unit and hair shaft caliber is 0.05 mm, then the coverage value comes 5.4. This is a little bit complicated concept, but I'm making it very easy for you, that just 45 grafts per centimeter square if the caliber of the hair is 0.05 mm. Usually the hair caliber in the Asian, especially in the Pakistani population, is between 0.03 to 0.06 mm. So this is the coverage value, that is for the donor and recipient area both. So now if we want to calculate the follicular units per centimeter square, how we will calculate? First of all, we need to see the hair caliber. There is a calibrometer that is very easy to buy from Amazon. But usually we see and we can say that this is 0.03, this is 0.05, 0.06. If we do a little bit of the measurements after 4 or 5 months, you will be able to do it. But ideally, every hair transplant we need to measure the calibers. So if we consider the hair caliber as 60 micron meter, so and we consider that the follicular unit per centimeter square is like 2.2 hairs. So then how we can calculate? We can put the this formula: follicular unit per centimeter square is equal to coverage value divided by hairs per follicular unit multiplied by hair caliber. That means follicular unit per centimeter square is equal to 5.4 divided by 2 multiplied by 0.06 is equal to 45 grafts. So by these are the factors that are affecting the coverage value. So there is hair shaft diameter, that can be 0.03, that can be 0.05, that can be 0.06. That there is that how you make the sides, because the vertical sides and horizontal sides creates the huge difference. Like if the patient has already the existing graft, then we cannot make the sites that are coronal, because that can cut the existing hairs. So we have to go for the sagittal sites. But the graft interlocking is like, you do not consider one graft, you consider 3 grafts together always. Whenever, wherever in your canvas you place a graft, you do not place one graft, you place at least 3 grafts together. 3 grafts together. So that means graft interlocking and design of surgical slits have a value that affects the overall coverage value. The number of the grafts per follicular unit, like if a graft has 2 hairs per follicular unit, or 1 hair per follicular unit, or 3 or 4, so this affects the coverage value. Then recipient area size, that if we have a very large area and we have a very limited donor supply, that can affect. Then there is the desired density, that how much is the desired density. The patient expectation is very important, that if a patient is expecting that I will have this type of the look, and he cannot achieve that type of the look, that also. Then the hair characteristics, this was often neglected. I was still not knowing it until I started serious readings about the exam, and then there were a number of things that hair characteristics: thickness, curl, and skin hair color contrast. Like in the African patients, the skin color contrast is like black skin, black hair, curl of the hair, you can do 20 gram per centimeter square and you get the coverage value that is near to the equal to the visual density is normalized. But in another case, like in the Caucasians or in the Asians who have the skin color is white, and the color of the hair is very black, and the curl of the hair, there is no curl in the hair, so that needs a more number of the grafts. So this picture that is shown in this slide is very important, that in all of the cases, like in my cases, I have a stamp that I created by a stamp shop, and I put that stamp that has 1 centimeter square, one box, and I put either 30 or 40, and I write in my report that either these are 30 or 40 or 50 gram per centimeter square. For creating the cosmetic density, the very important thing is designing the recipient area sites. Like at the frontal area, we need to make the 15 to 20 angle. These are creating incisions to mimic natural hair follicle growth. Then there is at the middle, the angle is increased, and in the center there is 45 angle. In the crown, we need to make the angles as per the existing template of at the scalp. So the hairline design is also very important. The density goals, that achieving adequate density without overcrowding is very important. Then angle and directions. So not only the angle but also the direction of the hair, that either it is going towards the right side, towards the left side, towards directly from the straight. So you need to see the existing template. If the existing template is not available, the canvas calls you to make the natural hairs. So in these cases, this picture is very important. This from the book, that 15 to 20 is the angle at the frontal hairline. Then at the side there is the very obtuse angle at the temporals, and a little bit 45-degree angle in the middle. Then for the cosmetic density, there are many controversies. My position over cosmetic density about the follicular unit per centimeter square should not be lesser than 50% of the natural existence. Like when we have a patient donor area, we see there are 75 grafts or 70 grafts per centimeter square naturally. So I consider that lesser than 35. This is my own experience, and almost all of the cases I try to calculate the coverage value also. So if 35 grafts per centimeter square we do at the recipient area, lesser than that will always give you the poor density. Then the natural hairline design, using different CVs for the frontal hairline and CV for the crown area, we can use the different CVs. Layering grafts, like in the frontal, very frontal, the transition zone of the hairline, we can put the single hairs, and then at the back side, in the definite zone, we can put the graft that has more thickness. Then the judicious distribution, that before time at the time of hair transplant, we decide about what the hairstyle would be. So for example, like if some person has a hairstyle like I have this hairstyle, so we can put the number of the graft more at the sides where he has to make the curl and to make a hairstyle for that. making a hairstyle before time and discussing with the patient, and then you judiciously distribute the grafts at the strategic sites from where a hairstyle can be made, can be very effective. Practical application of CV in different regions. So the frontal hairline usually comes with the 30 to 40 graft per centimeter square. The mid scalp comes with the 50 to 60 graft per centimeter square, and the crown area usually comes with 60 to 70 graft per centimeter square. Usually it goes like that with the Asian with the 0.05 mm or 0.04 mm. These are some of my own results, and if you see in this picture, you will see that there is a very good density. These all patients have recorded their reviews, and the number of the grafts were mostly more than 30 graft per centimeter square, but not more than 40 or 45 graft per centimeter square. The common mistakes, I have done so many mistakes in my life in hair transplant. The most important is overcrowding. Like you consider some area, like especially this zone that is known as also the watershed zone, and in the frontal area you put a lot of the grafts that can cause necrosis. The second is incorrect hairline placement. This can be while doing the hair transplant also. There can be an incorrect hairline, and there is inconsistent graft distribution. Like you put some more grafts at some place and less grafts at another place, so it gives the impression of baldness that has been spread to the different positions, and now the hairs that have been spread to the different positions. So my conclusion is that achieving the natural looking fuller density in hair transplant requires precise recipient area design, the canvas borders, Curry-Erdogan's coverage value concept. Determining the follicular unit per centimeter square gives a great guide, and a well-designed recipient area contributes to a long-term cosmetic success. I'm very thankful to you, and I'm really sorry. I welcome you, all of you. If anyone comes to Dubai, visit my clinic. I recently started my own clinic in Dubai, Sculpt Roots Medical Clinic. Thank you so much.